The next question from the audience is, what measures will you support to address the crisis in our mental health services, particularly for young people? So I'll start from this side.
Obviously, with the mental health issues, then those people with mental health issues need all the help they can get. And it would be remiss not to do more to try and help people and to try and because a lot of people with mental health, especially ex-military people, don't talk about their problems. They suffer them inside. So we need more communication with young people with problems mentally and to try and help sort them out.
Yes, the crisis of mental health amongst young people in particular is very forefront in the minds of the Liberal Democrats. It's there in our manifesto. I've already touched on this very briefly. We will be introducing a qualified mental health first aider into every single school to make sure that every single pupil has access to high quality mental health care, and this will be paid for by a tax on social media companies and other digital providers, so it won't come out of general taxation. More generally, we are looking to put mental health on an equal footing with physical health when it comes to NHS funding. So there will be a sharp increase in the amount of resources that are going in to mental health services that are going to be available to everybody through the National Health Service. Thanks.
It's not a scandal that mental health is basically a Cinderella service in the NHS, and it should not be that way. And young people are facing the worst kind of waiting times for CAMHS across our country, and it cannot continue. And I've already mentioned that mental health workers will be placed in every school going ahead. And this is particularly personal to me. As I mentioned earlier, my mum was sectioned a couple of years ago during COVID, but my husband also had bipolar disorder. His symptoms first started coming out when he was 14. And if he'd been picked up at school at a young age, he would have been able to manage it going forward. Cocktails of drugs, lack of support for actual cognitive support, lack of counselling, lack of support groups, is all a combination of stuff that we need to address going forward. But the first step is making sure young people have the resilience, and that's making sure that mental health support workers are in school.
The biggest mistake we made was locking down schools, because that left an awful lot of children who have never come back. The Centre for Social Justice, which I chair and set up, came out with a report talking about the ghost children, the children that have never gone back to school and we've lost. And many of those are outside of the schools. So we do need more support inside the schools. The government's talking about more money going into that help and support. It's absolutely vital. But there are outside areas that we need to deal with too, if we're really honest with ourselves. The effect of social media on our children, it's really devastating at times, and we need to deal with that one way or the other, either keep those phones, etc., out of their hands during school hours. The second thing is really important, the prevalence of drugs on our streets and the gangs and the gang culture, which snaps up children in that sort of age group very young. We need to work with the police and with the advisors and the mental health advisors. We definitely need to invest in that. Thank you.
So we've got to also ask the question about what is happening in our society to make young people feel so sick, right? What is going on with them, and why is their mental health so bad? And there's lots of underlying causes there. Of course we need more mental health support in schools, but what do we do on the two-child benefit cap? What do we do on overcrowded housing? What do we do? So many young people with mental health problems saying that they finish university and won't get work because they're struggling with their mental health. What is going on there? That's good jobs. It's the fact that their housing costs are so high and they can't move out. I mean, we need youth centres. So this is a much bigger problem. We cannot keep mopping up the mess. We need to look at those solutions that close the tap, that ask the bigger questions about society. Thank you.